2, 1.
Good evening. Chair calls to order Legislative Session Day 20-013. And Council, just as a reminder, we're meeting with again, a modified agenda due to the ongoing health emergency. And at this time, I'd ask you to stand for this evening's pledge, followed by the opening prayer by Councilman Schroeds. Pledge allegiance to the flag of the
United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
I'm sorry.
Dear Heavenly Father, we ask you to hear our prayers for healing the sick and infected during this unprecedented time. Health for our frontline healthcare workers and first responders so they may continue to serve selflessly. Protection for the elderly and most vulnerable. Help that our government finds the necessary resources to combat this pandemic. Patience for the parents and guardians of children at home. Support for those who feel lonely, anxious, and helpless. Peace and comfort for families who cannot be with their loved ones to say their goodbyes. May they feel your loving embrace. During this global crisis, we ask these things in your name, Lord. Amen. Amen.
Agenda item number 4, presentation of proclamations. Council, it's my pleasure to recognize Mary Hassler, our Harford County Public Library Executive Director, and I believe she's with us this evening. Mary, good evening.
Good evening, everyone.
We want to recognize National Library Week, and Councilman Woods is going to read in the proclamation.
Thank you, Mr. President. Thank you, Ms. Hassler, for being here with us. Whereas today's libraries are less about what they have on the shelves and more about what they can do with and for their communities, either through virtual services or in person visits, and have long served as trusted and treasured institutions for people of all ages, interests and backgrounds in cities, towns, schools, campuses, and whereas librarians strive to develop and maintain programs and collections that are diverse as the population they serve and offer members opportunities to explore new passions through technology, programs, and services, to find tools and resources to improve their quality of life. Librarians and libraries work to create an equal society by providing free access to accurate information to all people. Libraries are a resource for all members of the community, regardless of race, ethnicity, creed, ability, sexual orientation, gender identity, or social economic status, by offering services and educational resources that transforms lives and strengthen communities. In times of crisis, libraries play a critical role in continuing support to their communities. And whereas libraries, librarians, library workers, and supporters across America are celebrating National Library Week, now there we for the County Council of Harford County, Maryland, on this 21st day of April, hereby salute National Library Week.
Thank you, Councilman Woods.
Thanks.
Councilman Schroeds.
Yes, it's a great honor to present you this proclamation, Mary. And I just love being back on the Board of Trustees with you as the council liaison. But with that, again, I just want to thank you, the Board of Trustees, the Foundation, for all of your leadership. I know that libraries play an important part in our community, and we are fortunate to have such a strong library system in Harford County. That wouldn't be possible without the incredible dedication of the entire library staff, from the volunteers that put books on the shelf to the facilities teams that keep things running behind the scenes, award-winning marketing team, and of course, the librarians that are consistently developing new resources and programs for our county citizens. Mary, I also want to applaud you and your team for your innovation and responding to COVID-19. I know that you've moved resources online, providing new resources for free and offering free telehelp during the day for students struggling with online learning models. So thank you for that. Again, it's my pleasure to present you this proclamation honoring April 19th through the 25th, 2020 National Library Week. Be safe. Thank you.
Thank you, Chad. Thank you, County Council President. First of all, I'd like to say I always get a little butterflies in my stomach when we do this every year because it's so important to our library staff. This year, it's even more important. It's been a very difficult situation we've all been in. I want to say thank you to all of you. What you've been posting and the information you've been pushing out has meant so much, not just to the library, but to our entire county. So thank you for being there for us. Also, our staff were there. One of the most important things we've been doing is being flexible with our free Wi-Fi, which has been so critical, especially in the areas of the county where we do have deserts for our Wi-Fi and our internet. That has been amazing, and we are looking to expand that as much as we can in the next few weeks so everyone can get up to speed. But again, I want to thank you. I want to thank the library staff. We have an amazing, amazing staff and team members who are working every day. Some of them are working at home. Some of us are still going into work, wearing our mask and practicing all the things we're supposed to be doing now. But things are moving forward, and I just want to say thank you to our community. You support us. You make our library what it is. So thank you very much from the bottom of my heart. And please, everybody, be safe, be smart, and I'll be seeing you all soon in our branches. Thank you.
Thank you, Mary. Council, anyone have any comments they'd like to make? All right, seeing none, Mary. We just all appreciate all that you do. We just wanted to say that again to you. So thank you very much and be safe.
Thank you.
Agenda number 5, special presentations, our COVID-19 update. Scheduled this evening was Dr. Moy, our Harford County Health Officer, but due to a non-COVID family emergency, Dr. Moy will not be with us this evening. He asked that I just relay our latest county numbers, and there'll be more information to follow. So our numbers today, positive cases were up by 5 for a total of 232. And it does appear that our numbers for tomorrow are going to be much higher, close to 247. And with that, I'd like to turn it over to Lyle Sheldon, our CEO of Upper Chesapeake Health.
Thank you. Thank you. Good evening. I want to thank you all for hosting myself and my colleague, Dr. Fahim Yunus. And to remind you, as I've shared with you in the past, Dr. Yunus is a board certified physician on our medical staff in infectious disease at University of Maryland, Upper Chesapeake Health since 2001. In addition, he serves as our chair of infectious diseases, and he was also appointed as our chief quality officer in 2019, and also serves as a clinical associate professor of medicine with University of Maryland School of Medicine. And Mr. Chairman, if I may, I'd like to go off script just for a couple of minutes with a couple of other comments before I have Dr. Yunus move into his comments about COVID. And I want to thank all of you there on the county for your service. As I've had an opportunity to meet you, I want to thank you for serving this county, and also thank those of you that have been in the armed forces. Thank you for your service to this country. I also want to thank you for your patience as we've gone through this review and approval process for this whole initiative that we call Your Health Our Mission. For me, it's about trust. It's about mutual respect and shared experiences. And we at Upper Chesapeake take our roles and our responsibility very seriously during normal times or during this pandemic. We want our community to have trust and confidence in us as healthcare providers. And as we were in front of the Maryland Healthcare Commission last week, it's not about who's right, but it's about what's right. And we have a confidence level that the decision that was made last week on behalf of the residents of Harford County is the right decision. And as we transition over the next 2.5 to 3 years, Mr. Chairman, I'd like, with your permission, to come back in front of this council as the Board of Health to share with you updates about our progress. So again, I want to thank you for your patience as we've gone through this process over the last few years. And again, thank you as you've played the role that you've played. And again, for us, it's about caring for our community. It's about trust. It's about mutual respect and shared experiences. So with that, thanks again. And I'll turn the microphone over to my colleague, Dr. Fahim Yunus, and he will share with you really a role that we're playing here in this community to make our healthcare services available and accessible for you, for our residents, and for our patients. So thank you very much. Dr. Yunus.
Thank you very much for your kind introduction, Lyle, and also thank you to the council and Mr. Chairman. I appreciate this second opportunity to come in front of you. And Myla, may I request if you could load up the slides, please, so we could walk through the slides. And I still remember the insightful questions that the committee had last time. I appreciate those questions. And I hope that if you have any questions, kindly stop me along the way. Do not hesitate. You can interrupt me, or you can save them for the end, whatever is your preference. Next slide, please, Myla. So thank you very much. We just wanted to set the stage. You must be aware of these numbers, but so far we have over 14,000 confirmed cases in Maryland and 584 deaths. When you look a little deeper, nearly 75% of these cases are coming from 5 counties: PG County, Baltimore County, Baltimore City, Anne Arundel County, and Montgomery County. And as a comparison, our numbers here in Harford County, 232, are 1/10 of what some people are seeing in other counties. So you do see that somehow, and there may be various factors for that. And as we will go along, there's another point between Harford and Upper Chesapeake, but that's the big picture that we are seeing right now. Next slide, please. I request the next slide, Myla. Thank you so much. So on the left is a graph for United States. This is how we as a country, our numbers have gone up. And some of that directly correlates to the amount of testing. As we expanded our testing ability, our numbers started spiking, because many of the epidemiologists, infectious disease specialists will tell you that if we were testing somewhere in early February, like if we were doing 10,000 tests a day, you would see a very different curve. It will probably still end up where it is, but that steep curve, that steep uptick that you see, there is some correlation with testing. On the right side, my dear colleagues, is a graph which shows you Upper Chesapeake and Harford Memorial. It's quite insightful. By the way, these are daily census. So every day, the number of COVID patients, how that has increased for Upper Chesapeake Health. We started with our first case on March 8th, and currently we are carrying 24 patients in our hospital at Upper Chesapeake. The blue bars represent Upper Chesapeake. The orange dots, they're almost looking like dots. That's how few of cases we have seen at Harford Memorial. And I believe there is no surprise, as I said, when you go to Prince George's County, we see 2,000, 3,000 cases. As we come up to Baltimore County, the number of cases go down. As we come up to Harford County, the number of cases go down. And from Upper Chesapeake to Harford Memorial, as we continue to go up north, we are seeing a fading away of this outbreak. There could be many explanations for that. This is the kind of stuff we think about all the time. Why are certain things happening? We will, of course, know next year, and hindsight will be 2020. But as of today, if you were to ask me some hypotheses, the first point I would like to make, even though the number of cases are different, it's the same team, it's the same prep. And I can assure you, it's the same resolve. We have a command center at Upper Chesapeake, and we have a command center at Harford Memorial, and we are interconnected by a video link all day. And the tenacity that I see in that team is no different. Why then we are having less cases in Havre de Grace? There could be various reasons. Population density. If you look at the population density of New York, New Jersey, and compare it with Havre de Grace, one answer is right there. This virus likes when we are huddled together. And of course, the population density for Havre de Grace or even Bel Air is not the same. Social distancing. Perhaps people up in Havre de Grace are more aligned with the governor's orders, and perhaps they're social distancing. This is something that they are doing. So I would like to give credit where it's due. It also could be the number of large events. Up until March 10th, I know of people who actually then were telling me that they were attending concerts in New York City with 20,000, 30,000 people in attendance. So if your city or your town is not holding large events, that could clearly have an impact. Or the degree of travel, how many people are coming in to that place from outside. So there could be various reasons for it. I still feel that it's important that we remain vigilant and we remain equally prepared in both campuses, and that's what we're trying to do. Thank you very much, Mila. This gives you a visual understanding of our surge locations. I shared last time as well. As a hospital, we're very focused as to how do we take care of our people, our community. If numbers were to go up, where do we safely take care of our patients? There's a much detailed surge plan. I'm not going to go in those details and numbers today, but suffice it to say what you're seeing on the top is a patient pavilion that is being constructed in the parking lot of Upper Chesapeake as well as Harford Memorial. This is a hard fiberglass structure, and we appreciate all the help that we've received in putting the structure up from the county. And this is, literally speaking, is going to weather the storm. Previously, the tent structure was not as robust. So we believe this allows us to provide much better, much safer care to our patients if that time were to come where we were overflowing from our emergency room. So this can become our front door. At the bottom, there are 3 different areas of the hospital that I wanted to share with you. These are typically not long-term routine patient care areas. On the left, you see our PACU, where patients would go after their surgery. In the middle, where people will come before surgery. And on the right side is our cardiovascular lab. However, all of these areas have the infrastructure where we can safely take care of our patients. So we have a plan that at what stage we will trigger a certain unit to then move for us to start populating patients in these areas. And there's an exactly similar plan at Harford Memorial as well. Next slide, please. By the way, once again, my request, you can stop me at any time. This is when we go through this, and when you are doing this day in and day out, realize this is now over 2 months. We started this prep in February. Now we are in late April. You're dealing with a bunch of human beings. They need positivity. They need balance in their life. So we like to recognize the small successes that our team achieves along the way. And I'm just going to share a few of those. If you came to our command center, there's this wall where we call it COVID kudos. And we want to recognize the work that our team is doing. On the left side, this is the analyzer, the Cepheid Analyzer that is now at Upper Chesapeake and Harford Memorial. And this allows us to do coronavirus, COVID testing in-house. A month ago, if a patient came to us and we wanted to check whether they had COVID or not, we would collect the test, it would go downtown, and in some cases it would take 5 to 7 days before we knew the result. That was an agonizing wait. Today, we have the machine at both hospitals, and now when we have to do a test, it doesn't go anywhere. We have a turnaround time of a few hours. So that keeps not just our patients safe, it keeps our frontline safe. It's extremely important for them to know immediately whether they're dealing with a patient with COVID or not. At the bottom of that machine, you see that blue cartridge. I just wanted to share the pipeline with you as well, because some of this may look big and fancy, and some of this is very small and simple. But if we don't have a link of this chain, that reduces our testing capability. And those are some of the bottlenecks that we even as a country are facing on the larger scale. So that cartridge is extremely important. That's where the sample goes. The white little strip is the pipette that allows you to draw the exact amount of fluid, which is in that red bag that you see there. It's a pink fluid called the viral culture media. Just wanted to share the pieces with you so you could visualize why this testing becomes a challenge and why it's critical, because all of those pieces, we need to have availability of all of them. In the middle, on top, you see a picture of our team that has been very, very, I would say, with dedication, they have been doing this community sample collection. It was 13th of March, I remember. We had only one case at our hospital at that time. Our first case came in on March 8th. But we could clearly see the anxiety and the stress it was creating for our community physicians and their patients and their families, and our team members who all live in the community. People were having symptoms and they couldn't go anywhere to get a test done. And I think our population health team has done a fantastic job in partnership with our community physicians, where we had this mobile testing, and we are very grateful for all the help that we've received from the county to make these things successful. What this is a mobile collection site where now we have done more than 10% of all the tests done in Harford County were done by this mobile unit. And we've identified over 50 positive patients. And the way I look at that, these are not just 50 patients. I believe every patient had probably, it could have infected another 10, 50, 100. We don't know how many patients could have been, one patient, how many people that person could have communicated that infection to. So we believe that that could have prevented hundreds of cases in the county. And we're very happy and appreciative of this partnership that we have developed with our physicians, with our county, and with private labs. So this was a well put together effort still going on. As I said, we've done over 1,000 tests, and in some cases, we've even gone to facilities to provide that test where it was needed. At the bottom in the middle, you see a picture. It's a little washed out image, but coronavirus in some cases requires a negative pressure room in the hospital where the air is all pumped out. And just to make sure that when we were planning for a surge and more patient rooms, we wanted to make sure that our engineering team, whether they could very quickly create some of these negative pressure rooms. And I'm very, very appreciative and impressed with the ingenuity of our engineering team, where they put together this very quick process to actually turn a regular room into a negative pressure room. And people from other hospitals have looked at it and would like to adapt it. But these are the kind of things we're continuing to think about. How do we make sure that we dig a well before we are thirsty, that we are prepared? On the right side is another small step that our respiratory therapy team did. This is the monitor of a ventilator which typically, as you can see that bed through the glass door, that ventilator is right next to the patient. And our respiratory therapy team has to enter that room many times to either look at those vent settings or adjust those vent settings. And they created this system where the panel was taken off from the ventilator and brought outside the room. And this allows our team members to reduce entry into a COVID positive room and reduce their own exposure. This also preserves protective equipment for us, like gowns and gloves and whatnot. So these small little things, we want to celebrate the commitment of our team. Next slide, please. What are some of the uncertainties? If you ask me what keeps me up at night, and what keeps me up at night is that we may have crossed our peak, but I don't know how many more peaks we have to cross, because I don't believe there's only one peak in this whole outbreak. This is a map of all the nursing homes in the country. All those orange dots tell you where there's more than one COVID infection in a nursing home. You can see in the top left, Seattle, where it started, one of the nursing homes was badly impacted. We know that at least three nursing homes in the state of Maryland that have been in the news with large number of cases. At present, out of nearly 230 nursing homes in the state, 2/3 of them are reporting cases of coronavirus. These are vulnerable populations. And as our governor has very, very rightly said, we want to expand our testing capability. This keeps me up at night because, God forbid, if there's an outbreak in a nursing home, that can very quickly generate a peak for a neighboring hospital. It can very quickly put certain lives in danger. This is a vulnerable group. And then similarly, other areas where people are huddled together for some unavoidable reason are correctional facilities, or daycares, or shelters, boarding houses, homeless shelters, essential factories that may be running. So a lot of this is an uncertainty that is always on my mind as to how do we partner. And this is why we believe this is a continuum. I think this virus is a great equalizer. Your interest is my interest, is health department's interest, is our emergency team, our frontline providers, our police department. I think our interests are all aligned and we will rise together. Next slide, please. Where there are uncertainties, what is the impact of these uncertainties and what else are we seeing? What are the challenges and how are we managing them? This is nationwide. This is not unique to Harford County. But I think we need to acknowledge some of the challenges, which is medications. We are keeping a daily tally of which medications we have at hand for how many days. And we have a red, yellow, green color-coded system where we want to keep a very close eye. But we do see certain dips in certain areas. And as long as future supply continues to come, I think we're okay. But you're always thinking at the back of your head, what if this medicine is not replenished in a timely fashion? PPE, or personal protective equipment, as I've shared many times before, we're adequate. I can't say we're short on PPE. But at the same time, the reality is we all, the nursing staff, the doctors, we have been trained to use something once. And when you're reusing, which many people are reusing in the county, in the city, in the country, but there's always that nagging worry that are you going to run out of PPE? So you want to make sure that you're in that preservation mode. Even though we have testing in-house, we want to make sure that we're judicious with that testing. And then our equipment and our workers. Like everywhere else, we've had some team members who've had COVID positivity. We want to make sure that everyone knows that we're being transparent with our information. We are in touch with those team members. I've called almost all of them. And we have to recognize you can catch COVID in the community anywhere. So this does not mean that everybody caught it in the hospital or even a majority of them caught it in the hospital. I'm less worried about, I'm just making sure that we're taking care of our frontline team members, because this goes straight into the morale. Of course, there are trying times, but I can at least tell you I still see patients every day because I want to be on the front line in the trenches with my fellow team members. I've been at Chesapeake for nearly 2 decades. Of course, in this profession, every few days, you get a realization, you get a reminder, a patient will remind you why you chose this profession. The calling comes back at you, but the kind of calling, the kind of purpose that I've felt in the past 1 month, I cannot tell you. I feel like I'm within a bunch of soldiers. When I'm walking through my ICU and my IMC, I truly feel like I'm walking through a bunch of soldiers. Soldiers who take a bullet for each other. So there is absolute purpose in the team that you sense. But then the question is this going to be our normal? Are we going to get through this? And will life go back to normal? What that new normal is going to look like? Those are uncertainties on our mind. Next slide, please. Among these uncertainties, of course, every crisis has an opportunity. And we don't want to miss those opportunities. Some of those opportunities are for us to grow together as a county. Some of those opportunities are around innovation. And some of those opportunities force us to think outside the box. For example, novel treatments, convalescent plasma, hyperimmune globulin injections. They've been around for 100 years. They're experimental treatment. Now we have started a study at University of Maryland System to see when we give this plasma to patients, what are the outcomes? So we would not have done this study if it was not for the pandemic. And who knows what good may come out of it. Telemedicine and telecommunications, just this meeting, just look at it. And I was asking Myla before the meeting, what a transition the council has made. This is adaptation. You know, you've committed that the show must go on. And I think that's very inspiring right there and then to realize that as people, we're not being paralyzed by this virus. We're being cautious, but we're also making sure the show goes on. And same thing in the hospital. We are liberally using telemedicine. The other day, one of my patients, I FaceTimed the patient from my office. I did not go inside the room. And we had a beautiful, wonderful chat. And that patient's going to go home. So it just has shifted the whole paradigm of care for us. The other opportunity, we never knew the kind of love. I think you always know the appreciation, but crisis brings the good out of people. The amount of pizzas, the amount of food, the amount of masks, the community outpouring that we see in our command center keeps us going. It's really heartwarming. And then camaraderie among the team members, as I said, I cannot emphasize enough. I feel like I'm walking through a bunch of soldiers. You see that picture on the left where our ICU team is in a huddle when there was the day and the moment for prayer and reflection. This has brought people together. Next slide, please. This is my last slide. And of course, I'll welcome any questions. We don't know how long it will last. As infectious disease community, we'll be absolutely surprised and be happy to be proven wrong if it goes away in days and weeks. We don't think that's going to happen. It may last few months. It may bleed and blend into the flu season and the viral infection season when it's November or December. It may lurk around and wait for opportunities when we come together and let our guard down. It may wait for a Thanksgiving. It may wait for Christmas and continue to sort of rear its ugly head. But the point here is, should I wait for the virus to change, or should I change myself in the meantime? And I know you have demonstrated that by going digital with this meeting. I think that's leadership right there. We're doing the same thing. Survival of the fittest does not mean survival of the best, or survival of the most intelligent, or survival of the most strong. It means survival of the most adaptable. I hope that the presentation I've shared with you has along the way showed you some of that adaptation that we as a system are making. I once again thank you for the opportunity and would welcome any questions if you may have.
Thank you, Dr. Yanis, for your presentation. Council, at this time, Dr. Yanis, I believe you need to mute your mic.
Sure.
Council, at this time, if any of you have any questions for Dr. Yanis or Mr. Sheldon, now's the time. Okay, seeing none, I want to thank you again, both of you, for coming, and we'll look forward to speaking again very soon, I'm sure. Thank you for the update. Agenda number 6, approval of minutes. Public hearing April 14th, 2020. Legislative day 20-012, April 14th, 2020. Are there any corrections to the minutes? There being no corrections, the minutes stand approved. Agenda item number 7, introduction and consideration of resolutions. Mr. Woods.
Thank you, Mr. President. Resolution 015-20, refunding bond series 2020B, negotiated sale. Introduced by Council President Vincini at the request of the County Executive. A resolution to authorize the issuance, sale, and delivery by Harford County, Maryland, the county, of its bonds designated Harford County, Maryland refunding bonds, series 2020B. The refunding bonds in the original aggregate principal amount not to exceed $102,575,000 pursuant to the provisions of section 19-207 of the local government article of the Annotated Code of Maryland, 2013 replacement volume and 2019 supplemental. The Refunding Bonds Act, section 524 of the Charter of Harford County, the Charter, sections 123-40 and 256-26 of the Code of Harford County, the County Code, and Bill number 19-027, enacted on November 14th, 2019, effective January 13th, 2020. The refunding bill. For the purpose of financing the refunding of certain maturities of the county's outstanding consolidated public improvement taxable Build America bonds, direct payment. Series 2010B, the outstanding 2010B bonds issued pursuant to Bill number 06-19, 06-20, 07-16, 07-17, 07-18, 08-35, 08-36, 09-26, and 09-27. The maturities to be refunded of the outstanding 2010B bonds are sometimes hereafter referred to collectively as the refunded bonds, and including accrued interest and cost of issuance, providing for the increase or decrease in the aggregate principal amount of the refunding bonds not to exceed $102,575,000, confirming that the principal, premium, if any, and interest thereon shall be general obligations of the county, secured by its full faith and credit and unlimited taxing power, determining that the refunding bonds shall be sold by negotiated sale or competitive bid, appointing an underwriter, bond registrar, and paying agent for the refunding bonds, approving the substantially final forms of various documents to be executed on behalf of the county in connection with the bond, the issuance, sale, and delivery of the refunding bonds, including an escrow deposit agreement, if necessary, determining the date of sale, determining various other matters in connection with the issuance, sale, delivery of the refunding bonds. Resolution 016-20, CPI Bonds Series 2020A, negotiated sale. Introduced by Council President Vincini at the request of the County Executive. A resolution to authorize the issuance, sale, and delivery by Harford County, Maryland, the county, of its bonds designated Harford County, Maryland Consolidated Public Improvement Bonds, Series 2020A, the CPI bonds, in the original aggregate principal amount not to exceed $40 million, pursuant to the provision of Section 19-101 of the Local Government Article of the Annotated Code of Maryland, 2013 Replacement Volume, and 2019 Supplement. Consolidated Bonds Act, Section 524 of the Charter of Harford County, the Charter, and Sections 123-40 and 256-26 of the Code of Harford County, the County Code, confirming that the principal, premium, if any, and interest thereon shall be general obligations of the county, secured by its full faith and credit and unlimited taxing power, determining that the CPI bond shall be sold by negotiated sale or competitive bid, appointing an underwriter, bond registrar, and paying agent for the CPI bonds, approving the substantially final forms of various documents to be executed on behalf of the county in connection with the issuance, sale, and delivery of the CPI bonds, determining the date of sale, determining the average probable useful life of the improvements or undertaking with respect to which indebtedness evidenced by the CPI bonds is to be incurred, determining various other matters in connection with the issuance, sale, and delivery of the CPI bonds, and determining that the CPI bonds shall be consolidated for purpose of sale.
Thank you, Mr. Woods. Council, at this time, it's our pleasure to welcome Mr. Sandless, our county treasurer, and Mr. Walters from Special Bond Counsel, Miles and Stockbridge. Good evening, gentlemen.
Good evening. So, Council President Vincenti and members of the council, what I'd like to have first is for our bond counsel, Fabian Walters from Miles and Stockbridge, to kind of just discuss the legal aspects of this change, and then I'm just going to provide a little bit of the history of how the bond sale is going.
Thank you. Good evening, everyone. So for both the CPI bonds and the refunding bonds, these two new resolutions are in order for us to have a sale at a negotiated basis. The previous resolution, which we passed in February, allowed for a competitive sale, and due to the changing market conditions due to the pandemic, we wanted to have the option in order to do a negotiated sale. We would still follow the same procedures of actually getting the sale approved on the sale date, and the refunding bonds are still subject to market conditions. So if the market would swing and they were no longer in the money, we would no longer issue the refunding bonds.
Yes. So just to kind of provide a little bit of context, as we normally do, we were getting ready to do a competitive sale, which is whereby we put out our bond notice of sale to all of the to the investment community, and they bid respectively on the bonds. In this case, both the new money, the $40 million of new money, as well as refunding our 2010 issuance of approximately $100 million. What happened is on the day of the sale that we were anticipating, was St. Patrick's Day, so March 17th. That was right when things really started to change for the negative, and the market kind of froze up, and there was just this feeling that you couldn't go to competitive sale, and we really weren't sure how long that would last. And so at that time, along with Miles and Stockbridge and our financial advisor Davenport, we started looking at potential options to do a negotiated sale, and that's how most of the other issuers, the other counties, states, and the like, were having to get their bond deals done. And so what we wanted to start doing is to create that track so we could go down that way. Kind of since that time, we now think that the market is somewhat stabilized, and so our plan is that this negotiated sale is largely just going to be an insurance option, an option B, and our intent is to sell the bonds competitively next Tuesday, so a week from today, according to our normal procedures. But if something happens, and the way things are changing now, it seems that things change from day to day, we want to have that option so that if we have to pull the sale again, that we can kind of very quickly pivot to doing a negotiated sale and have that completed, because I need to have that the bond sold by the end of the fiscal year. Just do want to again remind that this process, whether it's negotiated or a competitive sale, again, always goes through the same procedures, which is exactly what our bond counsel stated. There is no other changes from what you originally adopted back in February. So it's the same projects, it's the same duration. All of those things are all certainly still the same. And of course, you will have the opportunity to approve the sale as well.
Thank you, Mr. Sandless. Thank you, Mr. Walters. I also want to thank you, Mr. Sandless, for the opportunity to speak with you this afternoon. And if you could, we had talked about a possible interest rate. You said it was hopefully below 3%.
Yeah, I mean, I believe again, never wanting to kind of judge the market, particularly in this environment, but for the past several years, under the Glassman administration, all of the bond sales have been under 3%. I think that's a testament to the county's AAA bond rating, as well as some of the other steps the county has taken, being able to get that strong rate. so we'll see what the market will do. But from what I'm hearing from our advisors and the like is that we should see a rate at that level again. So we will see. Either way, I'm sure it's going to be it'll certainly be a competitive rate, one way or another. Either if we go through the competitive market or if we do the negotiated sale, the intent will be to secure the most competitive rate as possible.
Thank you. Thank you. Counsel, at this time, any of you have any questions? Mr. Wagner.
I would just like to thank Robbie Sandless for the meeting that he provided yesterday for myself and a couple other council members to enlighten us on the terms and part of the projects that are in these bond bills, and also for the follow-up information that he sent to me today for some questions that I had asked yesterday. He was very thorough and did a fine job of letting all of us know what was in these bond bills, and I want to thank him.
Thank you, Mr. Wagner. Anyone else? Well, as you stated, Mr. Sandless, we are going to have a special session on the 28th. And typically when we introduce something into the record, we don't act on it the same night. But because we're in the nature of what we're doing, these resolutions will be up for a vote tonight. So with that, I want to thank you for your presentations. Be talking to you soon.
Thank you.
Thank you. So Resolution 015-20, Refunding Bond Series 2020B, Negotiated Sale. May I have a motion?
Mr. President.
Mr. Woods.
Mr. President, I move to approve Resolution 015-20, Refunding Bond Series 2020B, Negotiated Sale.
Thank you. You have a second?
Second.
Thank you, Mr. Schroeds. Moving and seconded to approve Resolution 015-20. Any discussion? Mr. Kearney.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Jan Giordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Biola.
Aye.
Thank you. There being 7 votes in the affirmative and 0 in the negative, Resolution 015-20 is hereby approved. Resolution 016-20, CPI Bond Series 2020A, Negotiated Sale. May I have a motion?
Mr. President.
Mr. Woods.
Mr. President, I move to approve Resolution 016-20, CPI Bond Series 2020A, Negotiated Sale.
May I have a second?
Second.
Thank you, Mr. Schroeds. Moved and seconded to approve Resolution 016-20. Is there any discussion? Mr. Kearney.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Jan Giordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Biola.
Aye.
Thank you. There being 7 votes in the affirmative and 0 in the negative, Resolution 016-20 is hereby approved. Agenda number 8, introduction and consideration of amendments. Amendment 1 to Bill 20-005, claims settlements. Councilman Wagner. You need to unmute your mic.
There we go. Would you like for me to read this into the record, or the Vice President read it in?
Yes, sir.
Amendment number 1 to Bill number 20-005 on page 1 after line 22, insert the following. E, at least once every 6 months, the county attorney shall file with the county council a written report summarizing all suits in which the county is a defendant and the demand for judgment is for $100,000 or more, which contains 1, names of all parties, 2, jurisdiction of case, 3, case number, 4, amount of demand for judgment, and 5, any other information the county attorney considers relevant. I think it's pretty self-explanatory what we're seeking here, and now is the time to amend Bill number 20-005 as we had the public hearing last week. And while it's open and available for amendments to come forward, that's why I brought amendment number 1 forward. so we could obtain more information and be more responsible to the citizens of Harford County for which we serve.
Thank you, Councilman Wagner. Anyone else would like to ask questions or speak to it? Councilman Beulah, you need to unmute your mic.
I didn't have anything to say.
I'm sorry. I thought I saw you speaking. Thank you. Anyone else? Thank you, Mr. Wagner. This amendment will be considered at a future meeting. Agenda number 9, business from the president. Again, we will be having our revised county council budget work schedule. Session schedule actually will be Thursday, the 23rd, April 23rd, Friday, April 24th, and Monday, April 27th. All will be starting at 9 a.m. in the morning. We spoke just a few minutes ago about a special legislation for a bond sale. Will be Tuesday, April 28th at 2 p.m. Also, my colleagues and I wish to express our deepest condolences to Bill Watson and his family due to the loss of his father. Bill works in our budget office. And then also, we also wish to express our condolences to Mike Cullum and his family due to the loss of his father. So Jeannie and I, my colleagues, I'm sure, would ask you to keep both the Watson and Cullum families in your thoughts and prayers. And with that, Mr. Johnson.
Thank you, Council President. I have nothing tonight. I yield my time back.
Thank you, Mr. Johnson. Mr. Woods.
Thank you, Mr. President. I'm going to pass tonight. Thank you.
Thank you, Mr. Woods. Mr. Jan Giordano.
Thank you, Mr. President. I'm going to pass as well.
Councilman Jan Giordano, we wish you the best and hope you get well soon. Just for the audience, we want you to know that Councilman Jan Giordano is actually coming from us by telecommunicating from the hospital this evening. So keep him in your thoughts and prayers. Yeah, non-COVID. That's right. Councilman Schroeds.
Thank you, Council President. I just want to congratulate my daughter for helping me last week deliver food to those who were seniors who couldn't get out of their homes and others through the Mason-Dixon Community Services. They do outstanding work up there, and I also want to thank not only their staff, but the volunteers, all of the donors who generously give funding, but also food. Sadly, Northern Harford County lost 2 loved individuals in their battles to this horrific virus. One of those is Jack Maurer. He was a teacher at North Harford Middle School. And also my dear friend, David Maycomer. So please keep their families and friends in your thoughts and prayers. And I guess on a much lighter note, there's a meteor shower tonight. So, get out there and see the stars, and should be pretty spectacular. I believe the sky's going to be clear. So that's all I have.
Thank you, Mr. Schroeds. Mr. Wagner.
I would just like to echo what Council President said in terms of the sympathies extended to the families, and just make a special note that Tina and I would like to extend our sympathy to the Watson family. My wife had worked with Bill for a number of years there at Treasury and Budget, and certainly we want to extend our sympathy to his family and keep them in our thoughts and prayers. Thank you.
Thank you, Mr. Wagner. Mr. Beulah.
Thank you, Council President. I just would like to say, Gene and I, this was the first day that we are off of our self-imposed quarantine since we had traveled outside of the state to Texas to see our new granddaughter a couple of weeks ago. So I want to say thank you to all my friends, my fellow council colleagues, for all the assistance and doing shopping for us and things like that, because we strictly adhere to the governor's orders. We did not leave our house other than for maybe a walk or something like that. So, but I'm free now. So that's all, Mr. President. Thank you.
Thank you, Councilman Beulah. Agenda item number 11, comments and input from attending citizens. Ms. Dixon, do we have anyone signed up?
Yes, Mr. President, we have one, John Malamo.
Thank you. Mr. Malamo, are you there? Ms. Dixon, is he unmuted?
I'm working to unmute him now, Mr. President, but it doesn't seem to be working. Bear with me one second.
Would he have his phone muted?
As an attendee, he would not have the ability to unmute himself. He called in as just a regular attendee, not the registered speaker, it appears. So I don't have the ability to unmute his mic.
Mr. Malamo, are you there one more time, please? All right, well, unfortunately, I guess he's having technical difficulty again. So hopefully we will get this ironed out. With anyone else, Ms. Dixon?
There's no one else signed up, Mr. President.
Thank you. With no one else signed up, then this meeting will be adjourned.